Welcome back to the EasyMed channel where medical and science topics are made easy. This video will be an overview to antihypertensive medications which are used to treat high blood pressure. In the next 15 or 16 minutes, you're going to save yourself a lot of time in studying. You'll learn the main classes of antihypertensives along with tricks to remember what those classes are and several tricks to remember the drug names, example medications, and mechanism of action of each class. I also made this chart to make it easy for you. And by the end of this video, you'll know everything shown. So make sure to watch the entire video, as it will save you a lot of time studying and reviewing. Let's first start by giving you a trick to remember the main antihypertensive classes. Antihypertensive medications are used to treat high blood pressure, also known as hypertension. The easy way to remember the main antihypertensive classes is to use A, B, C, D. A will stand for several different antihypertensive medications, the first one being angiotensin-converting enzyme inhibitors, also known as ACE inhibitors. The second A stands for angiotensin II receptor blockers, also known as ARBs, and the final A stands for alpha blockers. Moving on to B, this will help you remember beta blockers. The C will stand for calcium channel blockers. Finally, the D is to help you remember diuretics. While there are other antihypertensive medications out there, these are the main ones and generally the more common ones. You might also learn about central agonists and vasodilators. You can use the C to remember central agonists, and you can use the D to remember dilators for vasodilators. So as you can see, this gives you a great way to organize the main antihypertensive drug classes, so write this down and keep it in your notes. Now that we've learned an easy way to remember the main classes shown in the first column, let's learn an easy way to remember the drug names within each class. There's a simple trick for this using the suffix of each medication. ACE inhibitors usually end in pril. ARBs typically have the suffix sartan, alpha blockers end in osin, and many of the alpha blockers specific to treating hypertension end in zosin with a Z. The suffix osin or zosin apply to selective alpha-1 blockers. There are also non-selective alpha-1 and alpha-2 blockers, and they typically end in mine or mine. Some examples include phentolamine and phenoxybenzamine. They're usually considered in treating pheochromocytoma and cocaine-induced hypertension, but since they're used more for catecholamine-induced hypertension, we'll focus on selective alpha-1 antagonists for purposes of this video. The alpha blocker video will go into more detail on both the selective and non-selective types of alpha blockers, so just make sure you're aware that osin applies to selective alpha-1 blockers. Moving on to beta blockers, they have the suffix LOL, and many of the calcium channel blockers end in dipene or dipene, especially dihydropyridines. There are two main types of calcium channel blockers, dihydropyridines and non-dihydropyridines. Generally speaking, dihydropyridines are used more for hypertension as they target blood vessels, while non-dihydropyridines such as verapamil and diltiazem are used more for tachydysrhythmias as they target the heart. Since the dihydropyridines are used more for blood pressure, we'll be focusing on those in this video, but the calcium channel blocker video will go into more detail about both types. So just know the suffix dipene or dipene applies to the dihydropyridine calcium channel blockers. As we move on to diuretics, many of these medications end with "ide." For the most part, using these suffixes will be a great way to remember most of the drug names within each class. Just know that there are some exceptions out there, and this isn't a hard, fast rule. Now that we have an easy way to remember the drug names within each class, let's take a look at some examples. We know ACE inhibitors end in pril. Some examples include lisinopril and enalapril. ARBs have the suffix sartan, and some examples are losartan and valsartan. Alpha blockers, specifically the selective alpha-1 blockers, end in osin, such as doxazosin and terazosin, also pronounced terazosin. Example beta blockers include metoprolol and labetalol, and you can see how they end in LOL. The dihydropyridine calcium channel blockers typically end in dipene, such as amlodipine and nicardipine. Finally, many but not all diuretics end in "ide, as we can see with furosemide and hydrochlorothiazide. As we continue to work our way through the chart, let's take a look at the mechanism of action of each antihypertensive class. This will help us get a better understanding as to how the medications are used to lower blood pressure. Starting with ACE inhibitors, as the name suggests, they're going to inhibit angiotensin-converting enzyme, also known as ACE. Remember, angiotensin-converting enzyme is a part of the renin-angiotensin-aldosterone system. Specifically, it's involved in converting angiotensin I into angiotensin II. Angiotensin II is the active hormone involved in increasing blood pressure through a number of mechanisms. Angiotensin II combined to angiotensin receptors on blood vessels, which leads to vasoconstriction, and this increases blood pressure. Angiotensin II also increases reabsorption of sodium and water in the kidneys and augments the release of aldosterone from the adrenal cortex and the release of antidiuretic hormone from the posterior pituitary gland, and all of this will work to increase blood pressure. Well, if we block angiotensin-converting enzyme, then we will decrease the formation of angiotensin II. Without angiotensin II, we won't have the downstream effects of raising blood pressure. This can control high blood pressure as a result. There's a previous EasyMed video on the renin-angiotensin-aldosterone system if you want more information on this. It's linked down below in the description. Angiotensin II receptor blockers, also known as ARBs, have a similar effect as ACE inhibitors because they're also blocking the renin-angiotensin-aldosterone system. As the name suggests, angiotensin II receptor blockers will block angiotensin II receptors. In other words, they're angiotensin II receptor antagonists. Again, we can see the renin-angiotensin-aldosterone system. This time, however, we're not inhibiting angiotensin-converting enzyme, but we're blocking the angiotensin II receptors. If angiotensin II can't bind to its receptors, then we won't have the downstream effects we talked about earlier that would normally increase blood pressure. Moving on to alpha blockers, the mechanism of action is self-explanatory by their name. They're going to block alpha receptors. In other words, they're alpha receptor antagonists. Alpha blockers lower blood pressure primarily by blocking the alpha-1 receptors on blood vessels. Alpha receptors are a type of adrenergic receptor that play a role in our sympathetic nervous system, which is our fight or flight response when we're in stressful or dangerous situations. One of those responses is to increase blood pressure in order to perfuse our vital tissues and organs. We can do this by activating the alpha-1 receptors on blood vessels. Sympathetic catecholamines such as norepinephrine and epinephrine increase during a sympathetic response, and they bind to alpha-1 receptors on blood vessels. Norepinephrine has a higher affinity compared to epinephrine, however they both combine to alpha-1 receptors and activate them. Activation of these alpha-1 receptors on blood vessels causes vascular smooth muscle contraction and vasoconstriction occurs, leading to an increase in blood pressure. Alpha blockers lower blood pressure primarily by blocking the sympathetic activation of alpha-1 receptors on blood vessels. If we block alpha-1 receptors on blood vessels using alpha blockers, then norepinephrine and epinephrine can't bind to the receptor. Vasoconstriction will decrease, and this will help to control high blood pressure as a result. There are different types of alpha blockers, including selective and non-selective, depending on if they bind to alpha-1 receptors, alpha-2 receptors, or both. This will be discussed more in the alpha antagonist video. If you want to learn more about the different types of alpha receptors, where they're located in the body, and what their effects are, all that can be found in the alpha receptor EasyMed video linked below. There's also an EasyMed autonomic nervous system video linked